and in succession to the videos what I have been taking up on local anesthesia. So today's video I'll be mainly discussing upon the advantages and disadvantages of adding adrenaline to local anesthesia. So in the professional exams, this has been very frequently asked, that as to why whenever in local anesthesia administration is there, so adrenaline, which is a vasoconstrictor, it is added to the local anesthesia, that is the lignocaine or xylocaine. So the rationale of using these adrenaline to local anesthesia is very importantly, very frequently asked in the professional exams. So either they can ask you this question in the form of rationale of combining xylocaine with adrenaline or of local anesthesia, or they can ask you in the form of advantages or disadvantages of adding adrenaline to local anesthesia. So students and viewers, very importantly, so the first advantage, so firstly we'll be looking at what are the advantages of adding adrenaline to local anesthesia. So what is going to happen is that once adrenaline, which is a vasoconstrictor, if it is added to local anesthesia, lignocaine or xylocaine, what it does, it prolongs the duration of action of local anesthesia. So it is prolonging the action of duration of local anesthesia by decreasing the rate of absorption from the site into the systemic circulation. So this local anesthesia, it is going, once adrenaline is added to it, it is going to prolong the action of LA by decreasing the rate of absorption from the site into the systemic circulation. So this was one of the advantage as to why adrenaline is added to local anesthesia. Whether it be lignocaine or xylocaine, adrenaline addition is there just because this addition of adrenaline is going to prolong the action of local anesthesia. Next, the next advantage is it increases the intensity of the nerve block. So do remember students, just by adding this adrenaline, which is a vasoconstrictor, what is going to happen is the intensity of the nerve block. So whatever nerves, whether it be the inferior alveolar nerve block, whether it be the lingual nerve block, the greater palatine nerve block, the long buccal nerve blocks, whatever nerve blocks are given in the orofacial structures most of the times in dental surgery. So this addition of adrenaline to local anesthesia, it increases the intensity of the nerve block. Now, next very important point, that addition of adrenaline, it provides the bloodless field for the surgery. So whenever any kind of a local anesthesia is being administered for any kind of a surgery to a particular localized site, what it does is, since adrenaline, it is a vasoconstrictor, so the most important cause why this adrenaline is added to this local anesthetic agent, just because of the vasoconstrictor property. So the blood vessels, what are there, that it is going to provide the bloodless field. So since vasoconstriction is occurring, so blood vessels supplying to that area are getting narrowed. So obviously during any kind of a surgical operation or treatment, the addition of adrenaline to local anesthesia, it provides a bloodless field for surgery. Now, next important point, the next important advantage of adding adrenaline to local anesthesia is that it decreases the systemic toxicity. It is going to decrease the systemic toxicity by reducing the rate of absorption of LA. So once adrenaline is added to local anesthesia, what it does is that it decreases the systemic toxicity. So this enters into the systemic circulation. So addition of adrenaline is going to decrease the systemic circulation, systemic toxicity of LA. Just how? By decreasing the absorption of local anesthesia. Now moving on to the next, the disadvantages. So when we look at the disadvantages, that what are the disadvantages of adding adrenaline to local anesthesia? So the first important disadvantage is that just because adrenaline, it is a vasoconstrictor, what it does is that it causes intense vasospasm. So we can see that intense vasospasm and ischemia of the tissues. So adrenaline, it is a vasoconstrictor, and once local anesthetic is being added with this adrenaline, obviously the blood vessels are going to get constricted. So this is causing the ultimate vasospasm, what is the actual narrowing or the constriction of the blood vessels. And ultimately when a particular region's vasospasm is occurring in a particular region, so that is going to cause ischemia. That is ischemia, it is a condition where a transient decrease in blood supply is seen. So that particular site will be facing a transient decrease in blood supply and oxygen supply. So since there is a transient decrease in blood supply or the oxygen supply, what is ultimately going to happen is such area is going to have the condition what is called as the end arteritis, and that is going to ultimately lead to the gangrene of the fingers, toes, penis, tip of the nose, etc. Now, moving on to the next disadvantage, that the absorption of adrenaline with the local anesthesia may cause systemic toxicity. So systemic toxicity can occur if adrenaline is added to local anesthesia, and hence this local anesthesia, it is contraindicated in patients with cardiovascular diseases, like particularly the hypertensive patients, the patients who are suffering from cardiac arrhythmias, the patients of congestive cardiac failure, and in patients of ischemic heart diseases. So this vasoconstrictor adrenaline is contraindicated in patients who are suffering from these disorders. Moving on to the last important disadvantage of adding adrenaline to local anesthesia is that it may delay the wound healing by reducing the flow of blood to the affected area. So as I've already said, that whenever a local anesthesia, whether it be lignocaine or xylocaine, is added with adrenaline, which is a vasoconstrictor, it is obviously going to provide a bloodless field for surgery since the vasoconstriction is occurring. But its disadvantage can be seen as that since in patients who are immunocompromised, such as in patients of diabetes or who have decreased immunity, so this since vasoconstriction may cause delay in the wound healing process, just because the vasoconstriction is there because of adrenaline, and since this is going to cause decreased blood flow to that particular region, so that is ultimately going to cause delay in the wound healing to the affected area. So students and viewers, this was a very short discussion where I've discussed as to in the professional exams you are supposed to write as to why the adrenaline is added to local anesthesia, the advantages and disadvantages of this, or either they can ask you in the form of a question like the rationale of combining xylocaine with adrenaline of local anesthesia. If you still have any queries or comments, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, subscribe, and if you like this video, give this video a thumbs up and share amongst your friends. So students, if there are certain topics, if you want it from me, you're most welcome to comment me in the comment section. I'll be certainly taking up those topics for you. If you like this video, give this video a thumbs up and don't forget to share and subscribe my channel. Thank you for watching.